Good morning, it's Mark Larson at Public Health, and I probably will be doing more videos this week talking about our outbreaks at long-term care facilities. But first I want to talk about closure of Irene Reinhardt Park. So back on June 23rd, when we were approved to go into phase 3 of the opening Washington plan, I was very concerned about the part about large gatherings, and I could have carved that part out at that time, but chose to put that in. And what's happened since then is that people have kind of viewed that as that's a get out of jail free card to move into phase 3. So people are not socially distancing, people are not wearing masks, although that's getting better now that the governor has said we have to wear masks going in and out of stores. So that is improving a little bit. And people are having more get-togethers, which were allowed under phase 3, but it doesn't really mean that we shouldn't be still careful about what we're doing. So what we're seeing is we're having community spread. That community spread is starting from things like graduation parties, where we have 20 positives from one graduation party that occurred in Ellensburg, and we've had other gatherings at Salmon-Lesac, some gatherings in Kittitas, all with positives, because people are getting together and they're not socially distancing because they've forgotten that we still have this disease going on. My goals are to keep people from dying in the nursing home. We'll talk a little bit about that at the end. My secondary goal is to keep businesses going in our community, and my tertiary goal is to get school started in the fall. And to do that, we have to do something. My choices were pretty narrow. One was to move us back into phase 2 specifically, totally move us back into phase 2. Businesses, community. The second was to move the large social gatherings and get rid of those gatherings of people less than 50, which I think is a problem. And the third was to look at an area like Irene Reinhardt Park, which people have not been social distancing, people have not been wearing masks, people have not really been paying attention. And I don't have any specific cases related to Irene Reinhardt, but I do have lots and lots of cases related to people being out and about. And because of that, we've gone from having meeting criteria for going into phase 3 to having our rate of new cases, for example, being 113.1 per 100,000. We have to be less than 25. Our percent positive rate is above where it needs to be. Even to open schools, we have to be less than 5% to be safe to open schools. So I am responsible for closing Irene Reinhardt. I spoke with the county, I spoke with the city, and the decision was made to reevaluate that on a weekly basis as long as our cases are going down. All of our cases that are related to our 3 long-term care facilities are all related to disease that has come from the outside to the inside. And those people are doing things that are normal. They are out having barbecues with their friends, they're out going to their grandmother's birthday party, and they've forgotten about social distancing, as all of us have. So that's the reason Irene Reinhardt is closed. It was really a decision between closing Irene Reinhardt and encouraging people to be serious about this, and then maybe being able to do those other things, or just saying we're going to move back to phase 2. So that was my decision today, and we will move forward from there. I'll talk a little bit about long-term care at the end of this. So the questions today, they're really good questions. I'll just read them and answer them. So with the current outbreak in Ellensburg, what are the chances we go back to phase 2? I think it is needed, as people are not taking this seriously. It's really quite possible we will move back to phase 2. So that, as I've said before, is all dependent upon you. That's not dependent upon the work that we are doing at the health department, although we are working really hard here. I can't get you to stay at home or wear a mask or maintain social distancing, and that's what I'm asking you to do. Why is the number of positive cases still increasing when almost everyone is wearing a mask? It's because people are not all wearing a mask. People are wearing a mask when they're working at the grocery store. People are wearing a mask when they're going to the grocery store, but people are not wearing a mask when they're visiting with friends. They are not wearing a mask when they're having a barbecue at home. So that's why our cases are going up. Positive rate of tests currently 6.2%. After today, it'll be higher than that. The question about recovered on the community impact dashboard. We release people based upon time. So the health department releases people based upon 10 days and 72 hours without symptoms. At that point, they're considered recovered, so they do not need a second test. Should recovered individual wear masks in public? Yes, because we are not absolutely sure that you can not get that disease again. So we don't know how long immunity lasts. We know it'll last some period of time, but yes, you should wear a mask in public, and it's against the law not to wear a mask in public. A question about child care centers. Currently, Secretary Wiesman's directive about masking states that ages 2 to 5 are recommended. So under 2, children shouldn't wear a mask. I'm supposed to go to a wedding on August 1st. There's going to be 250 guests attending the wedding. Is this going to be safe to attend? The answer is no. So unless you maintain 6-foot social distancing and wear a mask and nobody hugs each other, nobody drinks alcohol, group get-togethers like that are problematic. We are not having any outbreak. We have not had any outbreaks or diseases related to the churches. The churches are doing a really good job in our community. But when we have a wedding outside, who's watching people wearing a mask? It's just not happening. So I would say it's not really safe to go to a wedding August 1st. Question about coworker with a doctor's note, unable to wear a mask. Currently, we're not requiring people to get a doctor's note. Labor and Industry does have some directive to businesses to get a note. This person said, our boss provided with a face shield and have not been wearing it. Just because you cannot wear a mask doesn't mean you can't wear a face shield. It doesn't. If your boss tells you that you have to wear a face shield, you have to wear a face shield, and that becomes a human resources issue with your business, not really a labor and industry issue. Some questions about the retirement home, whether they've been following protocols, whether government protocols are helpful, talking about whether or not how that's going to be helpful within schools. So this is all related to community spread. So the disease came from outside the facilities to the inside. One of those facilities, for example, is a memory care center, and people cannot those folks are not willing to wear a mask in the memory care center, nor are they willing to maintain social distancing. The staff is wearing masks, but you've got one person that's not wearing a mask, one person that is. That decreases the effectiveness. The other issue is, like we talked about before, people have been out and about, have become a little more lax. Those people have then gone to work. We had 2 staff positive at Meadows Place, no residents positive at Meadows Place. We have so far had 2 positive cases at Pacifica in their memory care center. We had 3, but one of those people were transferred back to Prestige. And as of this morning, we currently have 23 residents and 9 staff that are positive at Prestige. We are still waiting for all of our testing that we did 2 days ago at that facility. We will be doing testing at Pacifica, at their memory care center. They were all tested June 25th and 26th as part of state mandated testing. All of their staff and residents were negative at that time, but again, it doesn't take much to get them to come in. So really, it's not really a protocol. It's all of us really relaxing a little bit on our ability to maintain social distancing at home, to be wearing a mask, staying within our bubble. Just because we can do something doesn't mean we should do something. And it's going to be really sad when people start dying, because that's what we see and have seen in nursing homes across the country. These are people at risk. The ages of people that are positive go all the way up to 99 years of age. Deaths start usually happening 2 to 3 weeks after a disease like this, so it's very, very difficult. Going back to 4th of July, people had big parties, people were not maintaining social distancing. We're seeing some positives related to that. I would expect that to happen more often. So we are currently contacting all family members of residents that are positive at those facilities. The health department is contacting the staff. There was a question in here about whether or not people could be moved from one facility to another, or whether people could be discharged home to family. The question about being discharged home to family is really up to the facility. I can't really answer that question, but I would say the answer would be yes. We cannot really transfer patients between facilities. We don't really want people who have been exposed, and now we know that everyone in Prestige has been exposed, to be moving to another facility, so we expect to have a lot more positives there. But each facility has a plan for cohorting, putting all the folks together that are currently positive for COVID-19, having staff that are positive for COVID-19 take care of those residents. So we've been working really hard with, especially with Prestige on that. Again, as I mentioned, Meadows Place does not have any residents that are currently positive. So I want to ask all of you to be kind to each other. Be kind to the folks at the city, because that was my call to close Irene Reinhardt. And think about what we're trying to do here. We're trying to move forward. We're trying to get school started. We're trying to keep people in business, and we're trying to keep people from dying. And so wear a mask, maintain social distancing. Please don't go out and about, even though you can, and maybe we won't have to roll back to phase 2. Thanks a lot. I'll talk to you again tomorrow. Thank you.